inspiring. It is now my really great pleasure to turn to our next distinguished speaker, Ms. Muriuki, and I want to also note we started with the Berlin Hub for WomenX Collective, but then just a few months after, we launched the Nairobi WomenX Collective Hub with the great support of the government of Kenya and Africa CDC and Aga Khan University and many, many other partners. And Kenya was chosen not for random reason, not only, of course, because we have a great presence there with UNFPA program division, but also Kenya really has pioneered and scaled many, many innovations, including in the area of maternal health, supply management, award-winning solutions on family planning. It's just to name a few. So what lessons can you share with us from Kenya experience in mainstreaming those solutions when we go from the pilots to really scale nationwide? The floor is yours.
Thank you very much. You know, when you come after very excellent speakers, you lack words, and speakers like Dr. Kasea. Excellencies, distinguished delegates, colleagues, ladies and gentlemen, I want to bring you warm greetings from Kenya, where women's health is not only a moral imperative, but it is a national priority that anchors our social and economic development. Ladies and gentlemen, the burden that we must confront. One, every year, far too many women die from preventable causes. And when you look globally, 287,000 women die annually from pregnancy-related causes. And not just pregnancy-related causes, but maternal causes are only part of the story equally. Non-communicable diseases account for 7 in 10 female deaths worldwide. Cardiovascular diseases, cancers, diabetes, and chronic respiratory illnesses. And this reminds us that women's health is a life course agenda beginning in adolescence through the reproductive years and into older age. And addressing only pregnancy-related causes is not enough. Therefore, we must invest in returns that are systematic and generational. One, the economic case is very compelling in this. And evidence shows that every dollar invested in health yields up to $9 in social and economic returns. So family planning is one of the highest return investments because each dollar spent on modern contraception saves $4 in maternal and newborn care, prevents millions of unintended pregnancies, and averts tens of thousands of maternal deaths annually in low and middle income countries. Secondly, scaling maternal and newborn interventions could save up to 3 million lives each year at an average cost of $5 per person, and that generates up to $10 in benefits per dollar invested. The intergenerational effects are profound because every child whose mother survives childbirth is 10 times more likely to reach the 5th birthday. And healthy mothers raise healthier, better nourished, better educated children, reducing stunting, improved school performance, and increasing lifetime earnings. Now, Kenya has made significant and important gains in improving maternal and newborn health indicators over the past 2 decades, with increases skilled deliveries from 41% in 2003 to 89% in 2022. We are reforming the health financing to deliver universal equitable coverage. The new social health insurance mechanism, including dedicated funds for primary health care and emergency, chronic and critical illness, will guarantee essential women's health services without catastrophic cost. In 2023, we came up with Primary Health Care Act of 2023. We have the Digital Health Act of 2023, the Facility Improvement Financing Act of 2023, and equally the Social Health Insurance Financing Act of 2023. In Kenya, we are integrating life course women's health, combining maternal and newborn care with HIV, TB, malaria services, expanding HPV vaccination, and scaling cervical cancer screening and early treatment, and strengthening mental health and psychosocial support. Again, we are equally elevating quality and respectful care because Kenya is investing in emergency obstetric and newborn care, blood services, referral and ambulance networks, maternity waiting homes, and the continuous improvement of respectful maternity care. We are digitizing accountability. I have said in 2023 we came up with the Digital Health Act that interconnects data, interrelatability of data from one point to another. We equally are securing reliable supply chain for essential medicine and commodities, and partnering with counties, faith-based and private providers, civil society and development partners to target the underserved communities and reduce subnational disparities. The low and middle income countries can now prioritize public financing for women's, children's, and adolescent health by integrating reproductive, maternal, newborn, child, and adolescent health services into insurance benefit packages, ring-fencing budgets, and adopt innovative financing models. We equally must be able to strengthen primary health care and community services to drive health literacy, prevention, and timely care seeking, empowering women to make informed decisions. We must be able to invest in health workforce and quality of care, train, deploy, support midwives, nurses, and doctors. Everybody who is coming to the podium will talk about financing, we'll talk about infrastructure, equipment, but many a times is when we forget the healthcare workforce. And this is the engine of everything that we want to succeed in. The global community must be able to provide a catalytic and predictable financing for women's health as a core driver of human capital, and equally ensure by channeling resources to fragile, rural, and marginalized population where returns are highest and needs are greatest. So if there are funds that are to be taken to Kenya or any other country, then we must be able to do a needs analysis for each and every of the countries. And a call to a collective action, ladies and gentlemen. In a fragmenting world, responsibility means focus and follow through. So let us elevate women's health in global financing and policy priorities. Integrate women's health into systematic reforms, UHC, universal health coverage, primary health care, that every woman, no woman should die when they are giving birth. No woman should die because they do not have money to take them to any facility. And equally look into the digital health and workforce strategies. Forge global solidarity with measurable accountability and equity at the center. And this is because when we invest in women's health, we save lives, we strengthen families, and unlock economic growth. The returns are systematic, sustainable, and generational. Let us act boldly. The health of women is the health of our nations, and investing in women's health is investing in our shared future. Thank you. And now,
Thank you.
And now, I want to welcome you all in Nairobi for the World Health Summit regional meeting in April next year. Karibuni sana.
Thank you. Thank you, and let's give a round of applause to our distinguished speakers. And I will ask you to take your seats, please. And we are moving now to a next segment. Yes, please. Yeah. We can put you careful. Apologies, it took a little longer, but I just couldn't make myself to cut such